What is high blood pressure? High blood pressure, also known as hypertension, is a condition characterized by elevated pressure in the arteries. Blood pressure is measured in millimeters of mercury, mmHg, and is expressed as two numbers: systolic pressure over diastolic pressure. The systolic pressure represents the force exerted on the arterial walls when the heart contracts, while the diastolic pressure represents the pressure in the arteries when the heart is at rest between beats. Normal blood pressure is typically considered to be around 120/80 mmHg. However, high blood pressure is diagnosed when blood pressure consistently exceeds 130/80 mmHg. Hypertension is classified into two main categories. Number 1. Primary, essential, hypertension. This is the most common type of hypertension and has no identifiable cause. It tends to develop gradually over time, often due to a combination of genetic and lifestyle factors. Primary hypertension is influenced by factors such as age, family history, race, obesity, sedentary lifestyle, high sodium intake, and stress. Number 2. Secondary hypertension. This type of hypertension is caused by an underlying medical condition or medication. Secondary hypertension can be a result of kidney disease, hormonal disorders, such as Cushing's syndrome or hyperthyroidism, certain medications, such as oral contraceptives or nonsteroidal anti-inflammatory drugs, or conditions that affect the blood vessels. High blood pressure is often referred to as the silent killer because it typically does not cause noticeable symptoms in its early stages. However, if left uncontrolled, it can lead to serious complications over time, including an increased risk of heart disease, stroke, kidney disease, and other health problems. Managing high blood pressure involves adopting a healthy lifestyle, including regular physical activity, a balanced diet, low in sodium and high in fruits, vegetables, and whole grains, weight management, limited alcohol consumption, and stress reduction. In some cases, medication may be prescribed by a healthcare professional to help control blood pressure. Regular blood pressure monitoring and working closely with a healthcare provider are important to diagnose and manage high blood pressure effectively. What are the symptoms of high blood pressure? High blood pressure, or hypertension, is often called the silent killer because it typically does not cause noticeable symptoms in its early stages. Most people with high blood pressure are unaware of their condition until it is detected during a routine checkup or when they experience complications related to hypertension. However, in some cases, individuals with high blood pressure may experience certain symptoms or signs that can indicate elevated blood pressure levels or related complications. These symptoms can include: Number 1. Headaches. Some people with high blood pressure may experience persistent or recurrent headaches, particularly in the morning. Number 2. Shortness of breath. Difficulty breathing or shortness of breath, especially during physical activity, can be a symptom of high blood pressure or related heart problems. Number 3. Chest pain. Chest pain or discomfort, known as angina, may occur in individuals with high blood pressure and underlying heart disease. Number 4. Vision changes. Blurred vision or visual disturbances can be a sign of severe hypertension, potentially indicating damage to the blood vessels in the eyes. Number 5. Fatigue or confusion. Excessive fatigue, mental confusion, or difficulty concentrating can occur in some cases of severely high blood pressure or hypertensive crisis. Finally, it's important to note that these symptoms are not specific to high blood pressure and can also be attributed to other conditions. Additionally, many individuals with high blood pressure may not experience any symptoms at all, underscoring the importance of regular blood pressure monitoring and routine checkups. If you are concerned about your blood pressure or experiencing any of these symptoms, it is advisable to consult a healthcare professional for proper evaluation, diagnosis, and management. They can perform a blood pressure measurement and conduct further assessments to determine the underlying cause of your symptoms and provide appropriate guidance. What are the effects of high blood pressure? High blood pressure, if left uncontrolled or untreated, can have several detrimental effects on various organs and systems in the body. Here are some potential effects of high blood pressure. Number 1. Cardiovascular disease. High blood pressure is a significant risk factor for cardiovascular diseases such as coronary artery disease, heart attack, and heart failure. Elevated blood pressure puts increased strain on the heart, leading to thickening and stiffening of the heart muscle, as well as damage to blood vessels. Over time, this can result in reduced blood flow to the heart and other organs, increasing the risk of heart-related complications. Number 2. Stroke. High blood pressure is a leading cause of strokes. Uncontrolled hypertension can damage blood vessels in the brain, leading to the formation of blood clots or rupture of weakened vessels, resulting in a stroke. Strokes can cause severe brain damage, paralysis, speech difficulties, and even be life-threatening. Number 3. Kidney damage. Persistent high blood pressure can affect the kidneys and impair their ability to filter waste products and excess fluid from the blood. This can lead to kidney damage or kidney failure over time. Number 4. Eye problems. Hypertension can damage blood vessels in the eyes, leading to vision problems. It can cause retinopathy, which affects the retina and may result in blurred vision, vision loss, or even blindness. Number 5. Aneurysm. High blood pressure can contribute to the development of weakened areas in the walls of blood vessels, leading to the formation of aneurysms. Aneurysms are bulges or ballooning of blood vessels that can potentially rupture, causing life-threatening internal bleeding. Number 6. Peripheral artery disease. Persistent high blood pressure can cause narrowing and hardening of the arteries in the legs and arms, leading to reduced blood flow to these areas. This condition, known as peripheral artery disease, can result in pain, numbness, infections, and delayed wound healing. Number 7. Cognitive decline. Chronic high blood pressure has been associated with an increased risk of cognitive decline and dementia, including Alzheimer's disease. Number 8. Sexual dysfunction. Hypertension can contribute to sexual problems in both men and women. In men, it can cause erectile dysfunction, while women may experience reduced sexual satisfaction or decreased libido. Number 9. Complications during pregnancy. High blood pressure during pregnancy, known as gestational hypertension or preeclampsia, can lead to complications for both the mother and the baby. It may increase the risk of preterm birth, low birth weight, and other pregnancy complications. Finally, it's important to note that managing and controlling high blood pressure through lifestyle modifications, such as a healthy diet, regular exercise, weight management, and stress reduction, and, if necessary, medications prescribed by a healthcare professional can help reduce the risk of these complications and promote overall health. Regular monitoring of blood pressure and routine checkups are crucial for early detection and effective management of high blood pressure. What is the cause of high blood pressure? High blood pressure, also known as hypertension, can have various causes and contributing factors. Here are some common causes of high blood pressure. Number 1. Lifestyle factors. Unhealthy lifestyle choices can significantly contribute to high blood pressure. These include a diet high in sodium and saturated fats, excessive alcohol consumption, smoking, sedentary behavior, and being overweight or obese. Number 2. Family history and genetics. High blood pressure can run in families, suggesting a genetic predisposition to the condition. Having close relatives with hypertension increases the risk of developing it. Number 3. Age. Blood pressure tends to increase with age. The risk of developing high blood pressure gradually rises as individuals get older due to changes in blood vessel stiffness and other age-related factors. Number 4. Chronic conditions. Certain chronic conditions and diseases can contribute to high blood pressure. These include kidney disease, diabetes, sleep apnea, hormonal disorders, such as Cushing's syndrome or hyperthyroidism, and certain autoimmune diseases, like lupus. Number 5. Stress. Prolonged or chronic stress can temporarily elevate blood pressure. While stress alone may not cause persistent hypertension, it can contribute to its development or make it more difficult to manage. Number 6. Medications and supplements. Certain medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, corticosteroids, birth control pills, decongestants, and some herbal supplements, like licorice root, can raise blood pressure. Number 7. Dietary factors. Consuming a diet high in sodium, salt, can lead to fluid retention and increased blood pressure. Additionally, low intake of potassium, calcium, and magnesium, which are important for maintaining healthy blood pressure levels, may contribute to hypertension. Number 8. Alcohol consumption. Regular or excessive alcohol consumption can raise blood pressure. Limiting alcohol intake is recommended, with moderate drinking defined as up to 1 drink per day for women and up to 2 drinks per day for men. Number 9. Lack of physical activity. Being physically inactive or not engaging in regular exercise can contribute to high blood pressure. Regular physical activity helps to strengthen the heart and improve blood vessel health. Number 10. Race and ethnicity. Hypertension is more prevalent in certain racial and ethnic groups, including African Americans, Hispanics, and people of South Asian descent. Finally, it's important to note that high blood pressure often develops gradually over time and may not cause noticeable symptoms initially. Regular blood pressure monitoring and adopting a healthy lifestyle are essential for preventing and managing high blood pressure. If you have concerns about your blood pressure, it's recommended to consult a healthcare professional for proper evaluation and guidance.